Our health minister, Karl Lauterbach, hates the private health insurance, even though he's insured in the private health insurance himself. Oh boy, this is gonna be a good one. One of you sent over this article and video from 2010, oh okay, apparently discussing how bad the private health insurance is. I'm excited. Send over articles if you have any. So let's take a look at German health insurance in this episode of Financecouch. One thought about the publisher before going through the article. The link is RBB, but the website is ARD. Doesn't really matter because they're both public broadcasts tightly connected with the German government, which means they are funded by the TV tax, the 20 bucks you and me are forced to pay every single month. So without even reading through the article, I can already tell you what the message will be. Private health insurance is bad, everyone shall stay in the public health insurance. To me, the author or publisher is always important to know because there may be some political agenda that he's trying to push. But anyway, let's see what they're saying. I stopped the video at 2 minutes now. It says word for word what is written in the article. So if you want to check it out yourself, feel free to do so with the link in the description. You can Google Translate the article, so you don't need to understand the video. The first example is this fine man. He was a self-employed truck driver that switched to the private health insurance we don't know how long ago. And now he's retired with a monthly pension of 820 euros and has trouble paying his private health insurance premiums. First of all, I feel with you, Mr. Berger. Nobody should work here in Germany for decades and then live with an 800 euro pension. That's not right. But I can't really say that I'm sorry for you because the mistake has been made decades ago and now you are paying the price, unfortunately. Here's what I mean by that. He switched to the private health insurance because he was self-employed. That is what many self-employed people do, myself included. I'm also in the private health insurance. Why are we doing this? You employees pay only 50% of your health insurance premium. The other 50% are paid by your employer. Doesn't matter if public or private health insurance. As a self-employed person, you have no employer, so you pay 100% of the premium yourself. And that is why many self-employed go private or exit Social Security completely, because we would pay twice as much as you do. While they talk about his example and that private health insurances lure people in with cheap premiums, they showed this screenshot. 55 euros a month for a private health insurance. Pretty good, right? No. That's what we tell you in almost every health insurance video. Don't go for the cheapest private health insurance with 1-star coverage, because it will hurt you later on. If you stay in Germany for just a couple of years, go ahead and take a cheap 1-star private health insurance. But if you want to stay decades or for the rest of your life in Germany, you need to go for at least a 3-star private health insurance. Public health insurance has 1-star coverage, by the way, the absolute legal minimum allowed by the German Social Code. Here are randomly selected 3-star private health insurances that exist since 2013 with their price development. We cannot go back further than this because this is the year that Germany introduced unisex health insurance. Before that, we had different premiums for men and women. One increased by 1.142% year over year, or 12.1% in total since 2013. Another 3-star, almost 0.8%. 4-star private health insurances increased by 0.3% year over year, or another one with about 0.15%. And 5-star private health insurances with about 0.1% year over year, or this one, which is the only one that we didn't choose randomly. We searched for it because we wanted to see if it actually exists. Minus 6.2% in premium over the last 10 years, so it got 0.6% cheaper year over year. And just to prove my point that I'm trying to make, here's a 1-star private health insurance that increased by more than 50% over the last 10 years. So 4.3% year over year. So, Mr. Berger, if you really insured yourself for 55 euros a month in a 1-star private health insurance, then I can understand that you are paying the bill now. But that's common sense. If you buy something with a cheap quality, it's usually not that sustainable. And by the way, where's the money? If he insured himself for 55 euros, That's like 10% of what privately insured people with a good quality private health insurance pay right now. Let's say a pretty good private health insurance is about 500 euros. Public is almost 1000 this year. Both 50-50 with your employer, of course. But he paid only 55 euros. That's at least 445 euros a month he could have saved and invested. If he did, with the historic return of the stock market of 7% per year, he would have had 76,000 euros after 10 years, 227,000 after 20 years, or 523,000 euro after 30 years. My man, with the right financial planning, you should have more than €500,000 in investments right now. I don't know what happened in your life and I'm not gonna judge. But when the interviewer asks you if you would eventually end up in Social Security because of your private health insurance and you respond with, yes, only because of my private health insurance, you are already in Social Security. And with your 820 euros pension, you have trouble paying rent, food and everything else, not just health insurance. I don't know your story, Mr. Berger, and I'm not gonna judge you, but I feel you're making your private health insurance the scapegoat for the situation that you're in. Now, what about our health minister, Dr. Karl Lauterbach? He warns about private health insurance in this article, as he warns about care insurance, sun studios, that hospitals will close, that the entire health system is gonna collapse, about lockdowns, about getting rid of lockdowns. Lauterbach warns about gasoline cars, for a new killer virus that was supposed to come last year, his own party about durchwursteln, I don't even know what that means, that hundreds of people are gonna die every day. If Lauterbach isn't German with all his warnings, I don't know who is. He warns so much about everything that even the German public broadcast ZDF writes just Lauterbach warning again. The only thing he's not warning about is alcohol. Lauterbach recommends to drink at least 1 glass of wine or beer per day. Now you might be saying, just because he warns about absolutely everything doesn't mean he's not correct. And that's true. But if private health insurance is so bad as he says, why is he insured in the private health insurance himself then? Why are 2/3 of politicians in Germany insured in the private health insurance then? If it is so bad as they say it is, why are they not insured in the public health insurance? All they do is increase premiums for public health insurance while lowering the coverage, and then they escape from their own mess they made by switching to the private health insurance. It's just a bunch of hypocrites if you ask me. At the end of the video or the article, at 9 minutes and 20 seconds, they say the one sentence that shows me why the public broadcast really published this. And I cite, "The solidarity-based public health insurance is losing many young, healthy contributors." Ah, now we're talking. Thank you very much, government media, for being honest here. Because that's what you really want, right? More money from more young people to keep the pyramid scheme or public health insurance and public pension running for just a couple of more years. I talked about this, that this is not gonna work in this video just a couple of weeks ago. So check that out if you're interested. And if you want to exit from the public health insurance as well, like I did many years, feel free to book a free meeting right here if you have a gross salary of more than 66,600 euro in 2023. That is unfortunately the minimum salary required by the German government to switch from public to private health insurance.